Hello，大家好，欢迎来到洛杉矶华人资讯网的直播现场，我是主播莉亚。当一对伴侣想要自己的宝宝，却因为种种原因没有办法亲自生育的时候呢，他们可能会考虑第三方妊娠代孕者。那么这个也就是所谓的代孕。代孕的爱心妈妈，她可以极大的帮助到这些想要孩子的父母来圆梦。那实际上从上世纪70年代开始，美国就可以合法代孕了。经历了40多年代孕产业化发展，美国的代孕服务在合法国家和地位当中呢是处于遥遥领先的位置。不论是成功率、安全性，还是法律法规的保障，在美国做代孕都是您最为正确的选择。那么如何选择替您怀孕的爱心妈妈作为代母呢？代母有什么样的身体的条件要求？要做哪些检查？流程是什么样的？那今天呢，我们邀请到的是权威美国医学专家，从医学的角度上为您来解读。加入到节目现场的是 HRC 生殖医院 Newport Beach 分院的专家 Dr. Lisa Becht。她是美国妇产科科学院院士，双重认证的生殖内分泌学专家，曾经担任哥伦比亚大学生育中心的不孕症的主治医师，同时呢也是卵子冷冻和肿瘤生育科的主任。他也曾经获过多项的医学荣誉。Hello, Dr. Beck. Thank you so much for joining us today.
Hi, thank you so much. I'm excited to be here today.
So to start off, could you please briefly introduce yourself?
Absolutely. So my name is Dr. Lisa Becht. I'm here at HRC Fertility in Orange County in the Newport Beach and Mission Viejo offices. I've been here at HRC for over 5 years, and prior to this, I was in practice in New York City. I was at Columbia University Fertility Center, where I also did a lot of my training. And so I have extensive experience in all types of fertility, surrogacy, egg freezing, so pretty much all of it in the fertility world. And so I have great expertise, and I'm excited to share that with you today.
Well, thank you so much for sharing with us. So to start off, can you please tell me what the requirements a doctor typically has when selecting a surrogate mother?
Absolutely. So in terms of choosing a surrogate, I want to pick someone who, first of all, will hopefully have the highest chance of getting pregnant, and then even beyond that, hopefully staying pregnant and having a nice, successful, healthy pregnancy. So in terms of what those criteria are, really we are looking at her age, kind of what her history is in terms of her obstetrical history. So we want to know she's had at least one full-term pregnancy, and beyond that, she had no major issues in previous pregnancies. Really, ideally, we don't want her to have a history of miscarriages or any major problems for either getting or staying pregnant. And then there's very specific conditions that we're looking for in her records to make sure she didn't have something like major blood pressure issues or really intensive gestational diabetes. So we're looking at all of that. We're looking beyond the obstetrical history to look at medical and surgical history. And so really we're going through her entire medical history to make sure that she's healthy and will hopefully have no major risk factors for in pregnancy. And then beyond that, we're kind of making sure that her psychosocial situation looks good, and that she'd have good support. And so again, all of these different criteria we are using to try to pick our patients the best surrogate to get pregnant and stay pregnant.
Got it. That's a lot of information. So I've noticed that many couples, they often prefer younger surrogates. However, you mentioned about the specific surrogate mom should at least have one cycle of pregnancy. So does the age of the surrogate mother really affect the embryo transfer and the pregnancy?
So that's a great question. So yes, like you said, ideally kind of younger is better. I would say in terms of getting pregnant, we don't see huge differences on the age as long as that surrogate is able to take the hormones and get a good uterine lining. Where the age really comes into play is the risks for the pregnancy itself. So a surrogate who is over 35, and especially if someone is over 40, which typically we would not probably want to pick, the problems with that age is that there's an increased risk of blood pressure issues like preeclampsia, gestational diabetes, early delivery, needing a C-section, just based on that age risk factor. And so that's where ideally, like you said, we typically try to pick a surrogate who's on the younger side.
Got it. So age definitely seems to be one of the factors that people will consider. So when a surrogate mother comes to the clinic for her medical checkup, what does the examination include? And could you please walk us through, step by step, what is the typical process and how can we help during their procedure?
Absolutely. Well, I want to even start before we book that visit for the surrogate.
Sure.
You know, when we're working with our intended parents, we want to just maximize the chance that hopefully we are finding you that best surrogate. So before we even invite a potential surrogate candidate to come in for that kind of visit to our office, we will do an extensive look into her history. We will get her records. We'll make sure that there's no major red flags beyond what we've been told. We will often get a consult from a high-risk pregnancy doctor consulting service just to make sure there's nothing that would be a red flag before the intended parent, is getting the surrogate to come get evaluated. But once she passes all of those kind of checkpoints, when she does come to our office, it is going to be an extensive history and physical where we will be talking with her, going through her history one more time, taking her vital signs, doing a bunch of blood work, and then probably the most important part is actually checking her uterus. And so typically that would be done with what's called a water ultrasound, where we're going to put just a little bit of water into the uterus to open up the walls and just make sure there's nothing kind of hiding in that lining that would either make it harder to get pregnant or stay pregnant. And if all of that looks good and checks out, at that point we would finish kind of the steps of officially matching, which would include the final legal clearance.
Mm-hmm.
And at that point, hopefully be able to get the surrogate into her transfer cycle pretty quickly after that.
Wow, it's good to know that it's very detailed and so much evaluations are done. So people are curious about surrogate mother's blood type. There are people asking, okay, does the blood type have any impact on surrogacy process at all? So what is your perspective?
So really in this day and age with the medical technology we have, kind of people's worry about a difference in what we call the RH factor.
Mm-hmm.
So if a person carrying the pregnancy is RH negative and that baby is RH positive, we do worry that there could be kind of an issue if there was bleeding or right after delivery. But really nowadays we have something called ROGAM. So that would be something that if there is kind of that disconnect in a negative RH mother kind of surrogate versus the baby that she's carrying is positive, she would just be receiving ROGAM. Beyond that, the actual letter, if you're A positive or B positive, really that, from our research does not impact. So those are all things that we will look at in the screening and just make sure there's nothing outside of that kind of general blood type that potentially could impact her ability to carry a pregnancy.
Got it. Thank you so much for clearing that up. So once the surrogate mother is going through the embryo transfer cycle and IVF process, do you have any advice or recommendations for these moms to ensure the best chance for a successful pregnancy?
Absolutely. So definitely our team throughout will be very supportive in making sure that she's taking all the hormones and the medications correctly. All of the different parts of the transfer, we're monitoring ultrasounds, blood work, just to make sure everything is as ideal as possible. And then on the day of the transfer, that day we will give you very specific instructions to try to maximize the chance that that embryo sticks. So we'll have you come with a semi-full bladder. So by drinking and making the bladder a little bigger, it makes it easier to see the actual lining and when we're putting the embryo in, and it also makes it easier to put a transfer catheter in very straight. And then after the procedure, we will have her rest for about 15 minutes. At that point, we can have her get up and kind of go home. But really for 3 days, we would have her really take it very, very easy. No major exercise. It doesn't have to be absolute bed rest, but definitely just no major aggressive movements. We're really just trying to get that embryo some time to kind of settle in, hopefully start to implant. And then after the 3 days, we'd still say to keep taking it easy. Don't raise your heart rate. Don't raise your body temperature. We're just doing everything to ideally keep that embryo growing. There's also some kind of old wives' tales out there. So you hear people talking about getting McDonald's French fries after a transfer. Really, nowadays for a frozen embryo transfer, if you want some French fries, you can absolutely go get them.
Sure.
That was really more in the past when we do what's called a fresh transfer, when patients had a lot of hormones and they had a lot of bloating. Outside of that, people will talk about different foods. So pineapple, pomegranate, Brazil nuts. Those do have, good vitamins in them. I wouldn't say you absolutely have to take them, but there's no harm in doing that. Acupuncture is something that there definitely are some good studies that could potentially help. The two ways that acupuncture might help with getting pregnant from an embryo transfer, the first would be we think it increases blood flow, so maybe the lining is a little bit better. The second one is decreasing cortisol. So cortisol is a stress hormone that we see in the blood. So any way you can decrease stress, whether it's acupuncture or other things, we do think that can decrease inflammation and make it more likely that hopefully the embryo implants and stays growing. And so really all of those things we will discuss with the surrogate just to try to maximize the chance that hopefully she gets that positive pregnancy. And then in pregnancy, hopefully a nice, healthy, continued pregnancy.
Got it. So I heard that you have an exciting travel. You're heading to China, speak about the surrogacy and IVF process, and probably provide consultations to moms and parents. So are there any highlights that people probably can looking forward to your visit?
Absolutely. Well, I'm so excited to come. I've never been to China, so I'm so excited. So definitely if patients are there and they wanted to see me, definitely you can sign up. I'm going to be doing consults. And basically in those, I'm going to give you kind of personalized plans based on if you've done testing, kind of go through kind of what it would look like to do a cycle if you're going to come here to HRC with me. So really, if you have any questions or anything, please reach out to the team, and then I'd be able to meet you in person once I'm there.
That's awesome. So when a couple is looking forward to have a surrogate mother until they have a baby, so how long is the process? The estimated time.
So the first part is we need that embryo. So that would be coming here. First, we do some testing so I can give you a little better sense as to kind of what we're expecting. But from there, you would need to come here to HRC here in Newport Beach. You're here about 2.5 weeks. You'd be on birth control flying in. You'd get here, we'd do an ultrasound and blood work, kind of see how things look, and then go right into the IVF injections to hopefully get lots of eggs to grow, make embryos. So that whole process is about 10 days of injections and then a day of the procedure to take the eggs out. Really by the next day, some of our patients will fly home. But usually in general, I'd say from arriving to leaving, it's about 2.5 weeks, and that is making embryos. Those embryos are frozen, and while they're frozen, we're going to do extensive testing on them. That's going to include looking for genetic abnormalities like Down syndrome. We will know gender. If you are very interested in one gender versus the other, we could do a sperm wash to try to increase the chance of getting your desired gender. So those are all the things that would be done first to make an embryo. And then at that point, once we've confirmed we have an embryo for you, we will then be working with an agency to find you a good surrogate. Definitely surrogates, like we said, I like to try to pick one that is a high chance to get pregnant and stay pregnant. So sometimes it does take a little bit of time to find that perfect candidate, but the agencies we work with are fantastic in trying to expedite that as quickly as possible. And then in terms of the actual time, I would say, to be reasonable, it could be, unfortunately, a couple of months in terms of finding the surrogate, getting here to come for screening, and then her being able to work that into her schedule to do the embryo transfer. But all of that would be expediting as quickly as possible if that's what you're interested in.
That's awesome. So lastly, are there any common misconceptions regarding the surrogacy you wanted to talk about lastly?
Well, so people always just kind of ask about, if we implant this embryo, could the surrogate kind of take the baby? So California is a fantastic state on the legal side that is really very pro-intended parent. So legally, definitely the maternal and paternal rights are never questioned. We do have some surrogates that will come from other states. So that's where, again, we will work with the agency to make sure we're picking surrogates from states with good surrogacy laws. So I would just say that, we have very good, records here of having nice, safe pregnancies. You would just come, be able to get your baby once the baby delivers. And a lot of our surrogates are fantastic. They will kind of keep you on that journey throughout if you want to do that, FaceTiming you at visits and, if you come for the delivery or after. So definitely, I think, using a surrogate is a great way to have a nice, safe, healthy pregnancy.
That's awesome. Hopefully, I think the audience can really learn a lot from this segment, and it's really informative. And I love your smile. You have a great smile.
Well, thank you so much.
Yeah, and any intended parents, if they're looking for the consultations or services, if you're in China, go to Shanghai, go to Guangzhou, and scan the QR code, because we do have Chinese consulting team. They're here to help you. Or if you're already in the US, just call the number. 我们来请这个导播老师把我们的这个电话来看一下，那都可以拨打中文咨询电话是 Linda 206-399-7700 Linda 206-399-7700。那么在之后的节目当中呢，我们可能也会继续连线 HRC 的专家，为大家来讲解有关更多代孕或者是一些基因选择方面的更多的注意事项。Thank you so much, Dr. Becht. It's great to talk to you. Looking forward to talk to you next episode.
Oh, thank you so much, and thanks to everyone listening.
Great, thank you. Bye-bye.
Bye.
Hi everyone, my name is Dr. Lisa Becht. I'm a double board certified reproductive endocrinology and infertility doctor here at HRC Orange County. I am in the Newport Beach and Mission Viejo offices, and I'm so excited to be chatting with you today. So I'm actually from the East Coast. I grew up in Connecticut, and then I was in Boston at Boston University for undergraduate. I was then in DC at Georgetown University School of Medicine. And then I moved to New York City for the rest of my training. So I did residency and fellowship at Columbia University. And then I stayed on there as an attending physician for 3 years, where I was a very busy infertility doctor, but I also was the director of egg freezing and oncofertility. And then after that, I moved here to Orange County, and I've been at HRC for the last 5 years. I was always interested in helping patients. And so in medical school, I was really drawn to the field of obstetrics and gynecology. And then within that, we actually got the chance to rotate through different electives. And so I actually got to spend a month at a fertility center in Washington, D.C. It was so interesting. I loved being able to help a lot of the patients that came through the doors. And it was just such a invigorating field. Additionally, I've always loved the science and the technology aspect of medicine. And so specifically for fertility, there's just always changing opportunities, different things we can do and change in a clinical practice and a laboratory practice. And so in medical school, I was just so interested. And then from there, went on to OBGYN residency, where I confirmed I really did love fertility. And then from there, I went into fellowship, and now I'm here. Again, I'm Lisa Becht here at HRC Fertility in Orange County at the Newport Beach and Mission Viejo offices.